Hello, everyone. Welcome to another edition of Meet the People. My name's David Feiner. I'm the Communication Technology Manager in the City of Pittsburgh's Department of Innovation and Performance. And today, on this edition, we have one of my absolute favorite people in the entire city-county building willing to sit down and talk with me about technology in her field. Everyone, please welcome Laura Drogowski.
Hi, David. Thank you so much for having me today. And I want to return that sentiment. Also one of my favorite people.
In the moment. I'm one of your favorite people in the moment. I mean, that might change in the next moment. Let's see how this interview goes before you continue with that. Laura, for those that may not know, has recently been named the manager of the new Office of Community Health and Safety. That is a new office for the city of Pittsburgh. But before we get to that point, Laura, why don't you, for those that don't know you or aren't aware of your work, why don't you give us a little bit of background, where you're from, how'd you get here, and what it is you're doing in this new office?
Absolutely. So immediately prior to the new role that I've taken on, I was the Critical Communities Manager in Mayor Peduto's office. And that role served, I think, as an opportunity to provide a bridge between human services, social services, public health related services across the region with the city government and the constituency and residents of this wonderful city of Pittsburgh. In particular, we identified that public safety professionals are very often engaged in and encountering situations that don't meet their training and that they are being called to address because they are available 24/7. When you call 911, a police officer will show up, a medic will show up, a firefighter will show up. So it was using the public safety infrastructure as a safety net when other services were closed or when other services couldn't meet the needs of our community members. So that was the role that I played in the mayor's office. But prior to joining the city, I worked for a UPMC-GE joint venture working to make technology work for people from a diagnostic perspective. So in particular, it's the field of pathology. So it's the diagnosis of disease and other processes through microscopic analysis. Lots of words to say. People who are very brilliant, who look at glass slides and try to understand why something's happening in your body that you don't expect. But the challenge, of course, was one of diagnostic equity. If you lived in a region where you had access to subspecialists, and there were a lot of them, you could get an appointment quickly. You could get your tissue looked at quickly, and you could get it looked at by someone who was really expert in doing that work. So we wanted to make sure that that opportunity was available for everyone, irrespective of where you lived, and you know, hopefully irrespective of what your insurance is and what coverage you have and if you have it at all. And so I worked on negotiating and working with the FDA to develop clinical trials and working with the providers themselves to understand how they use the current tools they had. I also had the great privilege and continue to of working with an organization called Prevention Point as a volunteer and a board member, making sure that people who use drugs have access to sterile supplies and can access resources like case management and substance use treatment when it's appropriate, and also have access to things like naloxone or Narcan, which can reverse an overdose. So I've had a lot of really enriching experiences that have taught me a lot and brought me to this new role as the manager of the Office of Community Health and Safety.
So correct me if I'm wrong, and I'm usually wrong, but what you just described as your work history is you are a really smart person.
I'm certain you're wrong. I'm just, I'm a person who's gotten to see a lot of different elements of how people access healthcare and health resources. And that includes public safety's role in that work and our providers in the human services community and our healthcare providers and technology.
So what is, in the Cliff Notes version, what is the Office of Community Health and Safety?
You know that Cliff Notes are hard for me,
yeah, I know.
but I'll try. So the Office of Community Health and Safety, I think, is something that has long been in the making, not just in the local government here, but nationally, and it's long overdue. But the goal of the Office of Community Health and Safety is to prevent crisis, prevent harm for people. So what are the things we can do upstream? Public health interventions, stabilization of individuals and their families so that public safety engagement is not necessary or not occurring. What are the things we can do at the point of crisis or at the point of a 911 call to make sure that the person who responds or the group that responds is the best trained and supported to meet the needs of that individual? I think one of our officers said sometimes that officers get called because a kid won't eat their broccoli, and the officers don't think they should be in that situation, nor do we. So who might be a more appropriate person to support that family and help them to address what must be a really exhausting time. And then what are the ways we help to stabilize people? So after an engagement, we want to make sure there are connections to whatever feel like safe services. Sometimes those are the traditional systems, and sometimes they're not, because those traditional systems may have failed a person. They may have been not accommodating of an individual. They may have expected an individual to change in ways that weren't possible. And I think that the sort of fourth piece of this is, what do public safety professionals see all the time? We have a lot of public safety professionals who see a lot in our community, and we need to be able to lift from them what they understand and what they see, and then apply that in ways to improve the overall well-being for people in our community. So it's really about, to be redundant, it's about the health and the safety of our community, and it has to be about how our community is defining it.
Being being the first manager of a brand new office, that gives you a lot of leeway to set standards that you are happy with. Is that an okay way to explain what you're doing as the first person to do this job?
I think so. And I think that maybe the most important priority is making sure there's standards that the community and that our first responders are also happy with. I think because of the pace at which projects need to move, oftentimes there are, I think that one of the officers said this, and I appreciate it because I resemble this remark, is there are times when desk sitters make decisions for professionals who are seeing something over and over and over again. And the decisions that I might make don't reflect the everyday experience that people have. And that's unjust. And that's certainly a way that we don't want in this new office to burn out or to lose trust with the people that it's built to support. So I think that this is not about any individual. I have the privilege of being in the role that I am, but I look at it almost as a conduit. What are the ways that we can always ensure that the people who will be involved in this office in any capacity are the ones who are setting the standards, and that we're constantly transparent and we're thinking about things almost in an agile framework. Mm-hmm. If something doesn't work, let's not wait until we've run out of grant money and we have to put in a report and assess it and say, boy, that was a spectacularly ineffective tool. What are the ways that we are, I think self-critical is always a difficult term to say, but rather what are the ways that we're self-reflective? Hey, this doesn't seem to be working. Let's talk to people. Let's understand why they're not entering information into this database. Oh, because this database adds 30 minutes to their charting process. Right. Well, they don't have 30 minutes for that. So the short version of that is that I think we really want to make sure that the expectations and the priorities are set by the people who are in the field or are receiving the services. So
in a way, it's being more efficient, ultimately being more efficient time-wise, people-wise, so that they are learning on the job, but also finding new and different ways to do the same thing. Yeah, I think it's I can't say that I'm the technology expert on this discussion, but I think it's something akin to human-centered design. Mm-hmm. It's what one of my colleagues called a person-first approach. Yeah. To how we provide services and care. As a quick example, we hear a lot about national models around co-response and alternative response. And we're going to learn so much from them because there's so much good that they've done. But if we
picked up that model and brought it here and did not talk to people and account for the differences locally in the ways that people may trust entities and have explored and engaged with them, it won't work. You know, and I think the other thing is that we want to do something quickly, right? We want to respond to what is a year of reckoning that this country has done around the way that we have responded to people who have unmet needs and people who are in crisis that in no way have a criminal bent. And I think that, you know, the part that we've failed to realize is you can't just add a social worker and call it a day. You can't just add one more call line or one more type of professional, that there's a whole host of nuances and complexities that we haven't accounted for. And if we want to do this right, it's gonna be a little bit of a hill to climb, but there's also the pieces that get fit in that we can do rapidly.
So bringing the discussion, so that you have said a lot of great things about what you want to do with the office. How has already and will in the future technology helped you get this going?
Well, that's an excellent question. I think data is essential. The ways that we understand, and I don't know if maybe interpolate is the right word, the anecdotes, the experiences people have with the larger context of how many times are we making these types of responses and where are we making these responses, has fully made the case for why this office should exist. You know, I think there was a there was a provider that required 700 plus police responses in a year. And I don't think that that's a failure of that provider. And I don't think that it's the fault of the police that they responded when called. But I think what we can do is look back at that information and say, well, why? Why were the police called? What are some tools and resources that we can invest to try to change who's called, how they're called, when they're called? And so even, you know, and I guess that sounds a bit vague, but I don't want to call out a particular provider. But the idea is that we have this abundance of data that we can both use to shape our new response, but also externalize for other partners to use. So very recently, there's a Vista member named Josh Schneider. He's a paramedic. He works very closely with me as we're building up this office and will be part of the office. But Josh developed an overdose dashboard. And he did that in partnership with Thomas Allison from INP, who I want to also thank for the excellent work they did. The thing is, the idea of dashboards isn't new, right? Dashboards are extremely important ways to make data accessible to people. But the point is making that data accessible. Mm-hmm. If we wait 12 months after that data, you know, the first point of an overdose to make that accessible to the public, my goodness, 12 months have lapsed. A lot of people have been harmed. And so we need to make that data more readily available. And that's an accountability piece and it's an awareness piece. So Josh and Thomas made this dashboard. And, you know, right away we're seeing increases month over month in overdoses. And if we look back, we started seeing those increases before the pandemic. So Q4 of 2019. So it's not just the pandemic, right? It's not just this deep social isolation and sadness that I think many people are feeling and coping with in different ways. You know, it's also, and we can curb this shortly, but it's also a drug supply that is really unpredictable and lack of care and access to care that people have. So even during the pandemic, we've seen people lose their insurance and their use has recurred, and they've gone from maybe a medication for their use to a substance that is illicit and can be really unsafe. So we can use that data in lots of ways, but when we have it early, it gives us the best chance of trying to intervene. Now, the important thing is Josh goes into our EMS charts and pulls that data out manually. and he has to go through narratives, and he has to look at what medics are seeing on scene. Now, we can't impose on medics to do more charting. My understanding is that's already a huge burden, but at the same time, we have a person whose job is to go read back through. So there's got to be this idea of what are the ways that we make this kind of information easily mined and externalized such that it doesn't require all this manual work. And that, I think, is where technology is where we need to be with it, right? Is that the experiences, the observations are useful and can be made useful to the public quickly.
You were talking about data and accessibility and the length of time for studies to be done. And I always remember the highway project done in my home city. They did a 5-year traffic study before they did the big dig, which was a 15-year, $14 billion over budget highway project. And by the time the tunnels and the bridges were all built, the traffic numbers were 20 years old. And it didn't help. Not to mention there were a lot of Boston drivers on the new roads also. The next question about technology is, so how are you at this point taking the information that you have and putting it into practice, I guess is a way to ask?
Yeah, I think that's the short answer is we're continuing to work on it. I think that part of it is trying to understand like the new and different ways that we can elicit information from people. And I also think above all things, people matter. The people you hire, the people who interview you for this show, but generally people are the ones who matter too. So I think I always want to be clear that data is, the hard numbers are very much informed by the narrative, the experience that people have, and we have to have that balance. But that being said, I mean, we're using the Engage Pittsburgh platform, which actually we haven't launched that yet, but we will be by the time I'm sure this airs, to try to understand, and this is a newer initiative that we're working on, what helps people to feel safe. And there are already leaders in our communities who, whenever someone feels like something isn't going well, it's not an emergency, you don't need to call 911, maybe not yet, but you want to talk to someone who knows things. There are already community leaders who know that, and they're leaders in non-traditional sense. They're not necessarily elected. They're not necessarily the chair of a particular council. They're just a person on that block who really knows things and is very trusted and has earned that trust over years. What are the ways we can empower those leaders and support those leaders to continue to be those leaders? So we're using Engage to understand what people consider to be safe and how we can support them in being true community health and safety leaders, which is a large portion of this office. So that Engage platform, I think, has also helped us to deal with the complexities of trying to elicit information from the community during a pandemic. So how do we be safe, but how do we get that information? I know we talked about dashboards, but we want to keep pushing that externalization of data and transparency. I think there's been really great work by Dr. Heath Johnson, who works with the Analytics Bureau and the police to try to continue to make that information available to the public. I think that transparency is very critical. I think that other ways that we anticipate using technology are ways that we can hopefully help to get information from medics, from firefighters, from police, from their charting, from their reporting, that doesn't require them having a new app or a new tool. Right. Huge issue, right, is if you're already having to chart, and this, I mean, we see it in healthcare where you have 3 different systems you have to put the information into and they don't talk to each other. We don't want that, right? So we've had wonderful enterprising partners who've wanted to bring in new apps, and we have to say, wait, but let's think about the people. So I think we don't know how that gets done. I think that we will look to really great experts to do it, but we do know that we need to understand the human experience far better.
So we're recording this around the time the pandemic is hitting about a year mark. I can't believe I'm saying that, and I can't believe I'm hearing myself say that, but it has been about a year that we've been dealing with this. Thinking back to your job formerly as the Critical Communities Manager and now the manager of the Office of Community Health and Safety. How has COVID changed how you do your work?
Oh, well, probably like most people in every possible way. I think that the first thing is a lot of the way that I learned was to talk to people who did the work, talk to people who had the most intimate and deep experiences with struggle, with failures of systems, with successes of systems, all of those things. And that might mean physically going into areas where people lived outside, in the most respectful way, and a lot of meetings, a lot of in-person meetings, because I think looking people in the eye, not through a screen, although this is lovely, is important too. So I don't know, funny, I had never turned my camera on a Zoom meeting until the pandemic hit, and it took me a couple weeks to even do that because it's a strange thing looking at yourself in the Zoom world. But that you've been able to adapt to how do we elicit information from people, in so much as how do we elicit it from people who are in formal structures. We've lost a lot of information that we could have potentially been able to get directly from individuals who don't have access to this kind of technology. They don't have a phone, they don't have an iPad, they don't have internet service. I think there have been a lot of extremely excellent attempts and work to change that. Partners are making telehealth available. That's huge, and I am so hopeful that will sustain beyond the pandemic, and the resources and funding will as well, because that's low barrier. People who can use those tools don't have to get on multiple buses and sit in waiting rooms. They can get access to a physician, a nurse, another healthcare provider. This office wouldn't exist, I don't think, without the pandemic, because it laid bare the deep inequities that our communities face, whether it's food security, housing security, access to health care. This pandemic has, I think, really shown people who the haves and have-nots are, and those disparities have just deepened. So one of the RFPs that we were fortunate to put out early on in the pandemic, in partnership with Allegheny County through some HUD funding, was a new program that does homelessness outreach and co-response with our first responders. Our first responders have been asking for this help for a really long time. So this is something that they welcome the opportunity to do. So we put this out in, I should know, probably April or May. And the RFP intended to cover about half the city initially. We hope to move that to a full city coverage and beyond for this, whole concept of we don't want to have things in city that we don't have elsewhere. But the idea is that there's relationship building. People who are very well trained, supported, are able to go out regularly, engage with individuals who maybe haven't been able to work with formal systems or just don't know about them, because it's pretty hard to know about these things, to help to get them connected with whatever resources they identify that they need, and help to move them into safer, more stabilized environments. So we put that RFP out because of the pandemic. It's something we had always wanted to do, but we wouldn't have had the funds to do it. So I think that's probably the first initiative of this office, even predating the office. And it also is really our first initiative around city-driven co-response, which is very much the spirit of this office, is to help people where they are, to meet their needs as they define them, and to not have a kind of very rigid prescriptive system around that response. So the pandemic has, I guess in a way, pushed us as city government in this new office and across the country to move more quickly and to change what we're doing, because it's abundantly clear that a lot of what we're doing hasn't been working. And then, of course, George Floyd's death, I think, was you can't not acknowledge that fundamentally shifted the way that lots of people understood the public safety system and the needs of community members and structural and systemic racism in our society. So both events, while extremely catastrophic, I think also inspired some changes that are still going and hopefully will go on for a long time.
In a perfect world, budget isn't an issue, amount of people isn't an issue. What are some of your, you said you were interviewing for some of the positions in your office. What are some of perfect world wants, needs, desires for the Office of Community Health and Safety?
Oh, no one ever asks me that, David. I hope you have a bank account attached to it. So I think the first thing is to not reinvent systems.
Yeah.
We don't have a limitless budget, but even if we did, there are things that are working. There are organizations, and first and foremost, there are people who do this work really, really well. We need more of them. We need to pay them better, and we need to support them better. I think, this is, I don't know, maybe this is a strange thing to say on this show, but I always think there's something odd about the fact that we can pay people who do analysis of this information more than we pay the people who do the work. So I'm always a true believer that people who do the direct service work are some of our most excellent human beings in society. And full disclosure, my mother's a teacher, so I come from a household where I believe that that's really, really important work. So I think I'm having trouble even conceptualizing the idea of no budget or no budgetary limitations. So we would want to strengthen the existing systems, right? And not just strengthen them, but also break down preconceived notions that someone has to be a certain way to get a certain thing. There's this, how many hoops must a person jump through, and how many lines must they wade in to get this simple thing? And maybe in some ways, I said this on another talk, but I was thinking about this recently. Many people who are looking to access the vaccine are very frustrated because they can't. And sometimes it's technology limitations, but some of those people who can't access it are very used to getting things, right? Yeah. They have good insurance, and they have jobs that afford them that insurance, and they have a car, and there's a lot of access. And, maybe one might say there's even privilege. And now all of a sudden, people who are accustomed to getting things aren't, and they feel very frustrated. And they're having to sign up on 10 different websites and check all the time. And it's this constant state of stress. And it's not right. It's not okay. But the one thing I think it helps all of us to do is recognize what it must be like to get your basic needs met and to have to sit in tons of lines and to not have enough data on your cell phone to access your email or some other resource to be able to get some sort of documentation that you then need to show to 6 other people to get something. And I think that the point is that there's a lot of indignity that we may not personally have to experience that people who don't have things do. And so I would, perfect world, I'd like to see that we remove that we remove barriers to access. That's not necessarily in the purview of this office, but we want to do that advocacy, and we want to take that on our side as much as possible. I think another really important thing is to prevent trauma, prevent harm, right? So we want to have the right person respond to a thing, and sometimes that's going to be an officer, and sometimes that's going to be a medic, and sometimes it's going to be a firefighter, and sometimes it's not. But the best thing, the ounce of prevention is worth a pound of cure or something like that. What are the ways that we prevent these things from happening? So what are the ways that we make sure that people have access to healthcare and access to food, and that if there is some impending eviction or removal from a household, that we don't let someone become homeless before we help them? I mean, how crazy that it's like we have to demonstrate that someone suffers before they don't have to suffer anymore. So what are the ways we prevent suffering and we prevent trauma? And, I can think of some lighter examples, certainly not lighter, but maybe less comprehensive, where we know that there was during the summer, there weren't guarded swimming pools, and kids weren't necessarily getting swimming lessons, but it's hot, and kids swim in baby pools, and people swim in open water, and you can drown in all of those. Right. And one of our medics said, my goodness, I don't want to have to respond to those drownings. His name's Simon Taxel, and he just said, we have to do something. We have to get the word out that, these are the situations in which you can drown. And parents who are already under extreme pressure, we do want to encourage that vigilance when young people are in a baby pool, because they can, fall in and stop breathing. And so that's the kind of stuff we also want to do. What are the ways that we preempt these harms? We want to, as I said, stabilize after. So if someone falls, maybe an older adult falls in the shower and is harmed and is transported, but comes home to the same exact household, no security or shower bars, nothing else. Well, dang, what do we think is going to happen? Nothing's really changed other than this person's gone through all this trauma. So we want to stabilize on the other side. And a lot of that is, the upstream is public health and the downstream is making really meaningful, accountable service connections. And so those are amorphous, I guess the way we're describing it, but we want to elevate those ideas like Simon's idea, where when an officer, a medic, or a firefighter says, I'm really concerned about this particular thing happening and blowing up, that we preempt it. And we preempt it in partnership with public health entities like the health department and the School of Public Health at Pitt, and that we do our part too to support our public safety professionals and our community members. I think we need things like transport that is trauma informed. So often, the city has transport capacity. We have police cars and we have EMS trucks or ambulances. We have, fire trucks, although they're not transporting patients so often. But we need transport that's meant for whatever someone needs. So if someone needs to go to a mental health facility, we need something that resembles the kind of trauma-informed environment that will support them. So we need to think about not putting that on police, not having police transport someone in the back of a police car who's in a mental health crisis. What a baffling thing, really, is that someone who has a health issue is being transported in a police car because there's some perception that they're dangerous. So a lot of things. I think that it's examining the systems and the continuum at every level. It's prevention, it's intervention, and it's stabilization. And I think it's also recognizing what some of our first responders see on a somewhat regular basis, which is, I think the word would be horrendously traumatic. People have to see things that are really difficult for many of us, including myself, to imagine seeing. And there's many ways that people cope with it, but also supporting those individuals who have seen that and making sure that when they're not okay, they can tell us they're not okay. So those are some, low hanging fruit. No, just kidding. Those are our major things. But we also want to learn from what people already know so that we aren't trying to reinvent things ourselves.
So again, if I'm understanding you correctly, based on everything you've talked about so far, you have a lot of free time in your life.
Just like all city government employees. I don't think anybody has had a lot of free time in the last year, and that's city government and elsewhere. If it's not work, it's parenting. It's sometimes multiple jobs. It's trying to keep it together. But yeah, I don't think I've had a ton of free time in the last year.
Okay. Well, it's okay to admit that. I don't think anybody, like you said, anybody's had a lot of free time. This is the point where I'm going to ask you 4 completely random, have nothing to do with you or your job questions.
This is exciting.
Okay.
Okay.
Are you ready?
Yes.
First question is, what is the best COVID mask that you have seen or worn?
Okay, well, I haven't worn anything exciting. I wish I could say I had. I've just tried to stay with the most safe. Okay, well, I don't know if this is safe for TV.
It's okay.
I did see someone wearing underwear, women's underwear. So that was, I don't know if that's the
As a
best.
mask.
Yes, it was the most surprising.
That's new.
Oh, sorry.
It's okay. It's okay. It's totally fine.
Just, wrong half of the body it was on, I suppose.
But it was on the body.
That's true. That's true.
Recently, my wife got me, from a very popular show online, a mask, and it says, "You, David." And not only that, but a T-shirt that says it many times. But she didn't like my Hannibal Lecter mask, so I started wearing the "You, David."
What is it? It's I ate his liver with some fava beans and a nice Chianti.
Exactly. Yeah. Oh, you did that really well. Maybe too well. Do you have a hidden talent? Something that even some of your closest friends don't know about you. Something that you can do that no one knows about.
Oh my gosh, I don't think I do. I bring some plants back to life, but it's not like Lazarus or, it's...
For the people who can't keep plants alive, that is a hidden talent.
Well, I do find a great deal of satisfaction, when there's not a pandemic and going to the cheapy shelves at the store and trying to get the most bargain basement plants. Gosh, I don't know. I think my mother would say I have a hidden or not so hidden talent to fill every space in a room with piles of papers.
That's a talent.
I don't know if that's a talent. It's certainly not a skill, but it is something that I've done, and the pandemic has not helped with that. There's like a lot of leaning towers of Pisa paperwork in my apartment. I have to think on it. I don't know that there's anything particularly hidden and interesting, but stay tuned.
I have learned my hidden talent during the pandemic especially is taking naps with my dog. I have enjoyed that immensely. If there is a positive that's come out of the last year.
Well, I applaud you on that skill. I have a cat, but she tends to take up most of the bed, so the naps aren't particularly equal for us.
How big is your cat?
Well, she started the pandemic a bit smaller than she is now. I'd say she's put on a few pounds because she hasn't gotten to get as much exercise as she's needed. I'd say she's probably about 8 pounds. My cat before that started at 17. I found her in Lawrenceville, and she got all the way down to like 11, but the pandemic also was not particularly kind to her health. So she's convalescing at my parents' house, which has a yard. So I don't know. I think it's soon to come that this other cat may have to spend some time there too for overall health reasons.
My dog is 75 pounds.
Oh.
So I thought you were talking about a 25 or 30 pound cat for a second.
No, I don't. I don't have a like a world record holding cat, but it is a little bigger, I think, than the vet would like them to be. But they seem to be pretty happy, so I think that's what matters.
Okay.
Yeah.
Last binge watch.
Oh well, I think you just mentioned it. Am I allowed to say that on TV?
Probably not.
Okay. Well,
it's that.
Creek.
Okay.
I had heard from so many people that I should watch it, and David, I think you and I may have watched it at similar times, and I couldn't get through the first few episodes, and then I did, and then it was just all over from there. It was I don't know how you felt about that show, but
I had to pause a number of times because I was laughing so hard. If it were a movie, I would have had to go to the theater many times because I missed parts.
Because you were just uproariously laughing.
Yeah.
Yes, I had the
Sign
experience.
episode. I believe is the third episode.
Yes.
I think I got up and walked away for a couple of minutes because I had to contain myself.
When they add the addition, the addition to the sign, that's really
even better.
That's pretty excellent. So yeah, I did watch that. I would, it was very light. It was very nice to watch, and I think had a, I watched like the commentary or whatever after. And you don't realize, like, everything, life is hard for a lot of people, but there are plenty of people whose mere existence and what they experience every day is just so fraught with stigma and discrimination. And so I think that this was an opportunity for people to not have to watch a show that was just everything was negative and fraught. Right. It was certainly a family that was in their own kind of crisis, but it was good. So yeah, I love that. Yeah.
The other show I'm watching is The Goldbergs, which is a family outside of Philadelphia, Jewish, 1980s. Every episode has to do with one of my two parents, something they did or said, something that happened. Every episode I turn to my wife and say, oh.
Is that re-traumatizing for you?
I thought they missed out completely on, they did not do a bar mitzvah episode.
Oh.
And I thought they could have done a 2-parter or even a 5-parter on that, to be honest. Yeah, it was. But the '80s Jewish family, totally. That's exactly how I grew up. So not outside of Philadelphia, but still, most of the things that happened.
Everything else was generalizable.
Absolutely. Absolutely.
Well, I want to check that out, in the copious free time we all
yes.
have. But
yeah, and you said you have a lot of free time, so there you go. Newest passion. Everybody seems to have a new passion in the last year, something they hadn't done before that they decided to take on. So what's yours?
Well, I would say there's a few that I have attempted that haven't been particularly impressive. I have been trying to do spinning. I got really passionate about it for a while, and then I think I kind of gave myself some sciatica. So that was too passionate, although, plug to Alexandra Bood, who's the Victims Assistance Coordinator in Public Safety. She if you want to consult with someone about spinning, she's a good person to talk to. She's really excellent at it. So that was a kind of a failed attempt, although I'm getting back on the bike. Some insect pinning, which is something I did in high school, so maybe that's what you were fishing for or something in that last question. But trying to go, I think insects are really fascinating and beautiful, and so these are already deceased insects ethically, and trying to pin those up, but I haven't been particularly impressed with my handiwork there. Late night crocheting. I have made some Easter Bunny treat bags, some scarves for the holidays. None of it's particularly impressive, but I haven't made bread, so I can't say that. I have accumulated an enormous number of plants. So that's been a little bit alarming because I live in an apartment, and I think fairly soon the plants are going to take over. So no new passions, but maybe this exacerbation, or that's a negative word, maybe this enhancement of existing ones.
That's fair.
Yeah.
My son and I've really enjoyed, my son and I have been listening to a lot of kid-friendly stories about adult events. And one of them is called Rivals, and it's the one we listened to the other day was between Muhammad Ali and Joe Frazier. Another one was Nikola Tesla, Westinghouse.
Yeah, George Westinghouse. That makes sense.
So a lot of it's not just a one person reading a script. It's being acted out by a lot of people, and there's a lot of sarcasm, and he's getting to an age where sarcasm is big. So
I'm going to be honest, this sounds like drunk history without the alcohol.
Honestly, it kind of is. And we just started listening to one called Scoundrels of the World, which is about pirates, and it had a whole thing about what are pirates, and they made a joke about the Pittsburgh Pirates, which was really funny because he wouldn't have gotten it if we didn't live here. I've really enjoyed listening to these stories with him. That's my newest.
And Legos, but I guess that's not a new passion. But you guys have done some pretty impressive Legos.
We built the 11 billion piece Millennium Falcon.
Is that hyperbole, or was it really 11 billion?
11 billion is not a number, as he tells me many times. It was a lot. It was over 7,000 pieces, and it took us 30 days, 32 hours, something like that.
Oh my word.
And it was amazing. We had a great time.
Okay.
We really, really enjoyed that. And
Okay.
now it's a display piece. He knows it's not, well, it's 30 pounds, so it's not like he can lift it up and fly it around the house.
No,
it's,
and you'll never take it apart because,
never.
my goodness, why would you do that after all that work?
Exactly.
This will be something that when you're teaching him to drive and it gets very stressful, you'll say, remember when we put together the Millennium Falcon and it was so nice? Why is this so stressful?
I don't want to think about him driving.
Yes, okay, fair point.
Thank you. You can teach him to drive.
No, thank you. My poor parents when they taught me, so no. I'll reserve that pleasure for you.
Those were the 4 questions. So
okay.
Bringing it back, if anybody has any questions, issues, problems, concerns, anything they want to know about the Office of Community Health and Safety, how can they get those questions answered?
Sure. So we have an email address. It is OCHS PGH, so OCHS is Office of Community Health and Safety, PGH, Pittsburgh, at pittsburghpa.gov.
Awesome.
So if you type in OCHS as a city employee, it'll likely populate it for you. But also, the mayor's office can always refer you down to us as well. And I say down to us because we are getting our office space ready. And once everybody is vaccinated and safe, we will be occupying a space on the 4th floor. And we hope that when that happens, we'll be able to bring people into the office to meet with us and talk about their needs, and hopefully also see you all out in the community to better understand how, we can support you and do better.
Well, Laura, those are all the questions I have. I want to thank you for taking the time to be on Meet the People. I'm sure that as you continue on your work, you will make us all look bad with how great you are. And I really appreciate you giving us this information and giving us a chance to tell how government and technology intersect.
David, thank you. I will always remember that when we started doing overdose prevention training, you and your staff were some of the first who wanted to make sure that they knew how to use naloxone. I think you all represent the best of what the city government can do, which is care for people, make sure that they understand information, that it is accessible, and I appreciate you giving me the opportunity to do this, and I certainly will work very hard, and as will the staff, to make sure that we're making the city proud and meeting the needs.
Well, I'll make sure to. Do I make the check out to Laura or cash?
Well, I don't even know if I want to say that in public, but I'm going to say make it out to Laura.
Okay, that's cool. Well, thank you, the viewer at home, for taking the time to watch Meet the People, and we will see you next time.